So he was not informed the way he should have been informed, I feel. The expectation that he had was quite the contrary from what he was told.
And do you think that any of this had to do with other barriers, like language barriers?
Yeah, language barrier. Also, this assumption that I think many patients have that, and this is something that I had as a caregiver too, that we trust healthcare professionals to do their best to care for the patients. Although what I'm trying to say is I'm not condemning healthcare professionals. I just feel there has to be more open communication, that patients feel safe to speak up. Also, that healthcare professionals have to do all they can to communicate what is being expected and what is going to happen to the patient.
And then how did that experience with that doctor affect you, your dad, and your family moving forward? Did you continue seeking care from that primary care doctor?
We did continue with that doctor because he was specialized in geriatrics and he was Korean. And that's important for, I feel, the different ethnic background whose primary language is Korean. Although my dad was pretty fluent in English, there's a lot of things that matter in healthcare. So I think cultural synchronicity is important for patients with different ethnic backgrounds, not just because of the language, but culture. There's so much that different culture has effects on how patients live. So patients like to get care. I mean, and this could be an assumption. Some patients may not have a strong preference, but I think it makes total sense that patients want to communicate better with the doctor. So naturally, they may seek healthcare who share the same ethnic background.
No, it allows for the instant bond to be created. I think one of the themes that you've been saying over and over again is the importance of communication and clear communication. And there's nothing wrong with that. That's actually really important because the person who is actually the expert of their body is the patient.
Right.
And knowing how to be able to communicate your needs is essential because if they're not communicated well, then there will be some miscommunication from both ends.
Right.
Another theme that I'm hearing is also communication, not only between provider and patient, but provider to provider, so that we ensure that the patient is receiving the best care possible with all the specialists involved in the patient's case. And unfortunately, that also doesn't happen.
For us, by us, and just for us, this is Hope for Med.